putting your patients' lives back in balance with metabolic activation therapy provided by advanced diabetes treatment centers. 25 years of extensive research has led to a dramatic increase in our understanding of the pathophysiology of diabetic metabolism. Research began with the historic work of Dr. Thomas Aoki, former head of the metabolism section at Joslin Diabetes Center in Boston, and now professor of medicine at the University of California, Davis. Dr. Aoki focused on the critical role of liver dysfunction in diabetic metabolism. He theorized that the end organ damage in diabetes is caused by abnormal hepatic glucose metabolism, inadequate insulin delivery, and insulin resistance. Further research included multi-institutional studies performed in such prestigious institutions as the Mayo Clinic, Scripps Clinic, Summit Medical Center of Nashville, University of Arizona, University of Maryland, and the University of California, Davis. These studies have led to the only treatment shown to reverse the debilitating complications seen in patients with diabetes. It's called metabolic activation therapy. Metabolic activation therapy, or MAT, is a patented intensive insulin and carbohydrate therapy administered weekly in an outpatient setting. MAT is designed to restore critical carbohydrate pathways integral to healthy metabolism. Over 40,000 treatments have been performed with tremendous success. Once a week, patients receive treatments lasting 6 hours in an office setting. Intravenous insulin is pulsed at a predetermined rate and dosage. Effects on respiratory quotient and blood glucose levels are monitored, and an initial oral carbohydrate load is given before treatment begins and as needed during treatment to prevent hypoglycemia and to augment MAT. The process is 1 hour in duration, followed by 1 hour without treatment, and is repeated 2 times in a session.
What MAT therapy does is it rapidly raises the levels of insulin in the blood, which quickly get to the liver, and help to improve the liver's ability to utilize the circulating glucose or blood sugar. We're turning on, it's sort of like flipping the switch on. Think of it like a dimmer switch. And in a diabetic, the dimmer switch is way down on the liver. We're raising that dimmer switch so it's bright, you can see what's going on. And IV insulin pulsatile will do that. And the way in which we know that it's working is the respiratory quotient, or RQ, goes up, meaning that the body is becoming more efficient and utilizing glucose or blood sugar in the proper fashion, as a person without diabetes does.
We have seen patients that have showed a lack of progression of complications, including the retinopathy, which is the bleeding in the eyes. It seems to also involve an improvement in gastroparesis, which is this deregulated emptying of the stomach. It tends to also improve the sensation of hypoglycemia. Some of these patients with far advanced diabetes have lost the capacity to recognize a hypoglycemic event. We do see some patients that have improvements in metabolic control overall. That includes not only stabilization of their blood sugar levels, that also involves stabilization of their cholesterol, their lipid profiles. We are trying to conduct studies to look into perhaps stabilization of heart disease, the typical arteriosclerotic heart disease that diabetics tend to suffer from. We feel that there may be some evidence that we could potentially arrest the progression of heart disease.
Studies supported by ADTC to investigate the effectiveness of MAT therapy are ongoing at the Strelitz Diabetes Center at the Eastern Virginia Medical School, Johns Hopkins University, and the Joslin Diabetes Center in Boston. These are the current indications for MAT, which have not only been proven in exhaustive clinical studies, but have also stood the inevitable reimbursement challenges in the court system. Metabolic activation therapy is indicated for patients who, despite their best efforts, continue to experience unanticipated large swings in blood glucose levels, resulting in frequent episodes of hypoglycemia, hyperglycemia. It is indicated in patients requiring frequent hospitalization due to diabetic ketoacidosis. It's indicated in patients suffering from frequent severe hypoglycemic episodes with hypoglycemic unawareness. MAT is indicated when, despite intensive oral hypoglycemic agent and/or insulin therapy and blood pressure control with ACE inhibitors, the patient's renal function continues to decline. MAT is indicated when the patient with diabetes has orthostatic hypotension, not treatable by other therapies. MAT is indicated for patients with gastroparesis associated with diabetes not relieved by other drug or dietary therapies. Metabolic activation is indicated for patients with painful peripheral neuropathy, not relieved by conventional state-of-the-art intensive therapy and/or analgesics, as well as patients with background or proliferative retinopathy. Metabolic activation is indicated for treatment of non-gangrenous, non-healing leg ulcers not complicated by osteomyelitis and not responsive to other therapies. This list of indications is sure to expand as ongoing research, supported by ADTC, learns more about the effectiveness of MAT in restoring a healthy metabolism.
These ongoing studies that we talked about, I'm looking forward to seeing the results of that, because we know the number one killer of patients with diabetes is heart attack and stroke. It's cardiovascular disease. Now, we know that's the number one killer of everyone, even though there's those that don't have diabetes. The problem with diabetes, it happens 20 years sooner than it should happen. It's like diabetes prematurely ages your body. So you die of heart attack just like everyone else. Instead of dying at age 80, you die at age 60 of the same thing. So if we can slow this hardening of the arteries, this cardiovascular breakdown that happens, we can save lives.
Metabolic activation therapy is provided by Advanced Diabetes Treatment Centers, a company dedicated to providing physicians and their patients with the highest quality of care available. With the latest technology and support, doctors can help their patients become better equipped to monitor their diabetes, manage their symptoms, and live more balanced lives.